1. Which principle of adult learning is most relevant when designing CCDS training sessions for experienced clinicians? A. Emphasis on rote memorization. B. Focus on relevance to daily practice. C. Passive lecture-style delivery. D. Heavy reliance on standardized testing. 2. When evaluating a CCDS candidate's documentation, which method best ensures objective assessment? A. Allowing personal judgment of accuracy. B. Using a standardized scoring rubric. C. Relying on peer consensus alone. D. Ignoring ambiguous entries. 3. Curriculum development for CCDS preparation should primarily align with A. Organizational preferences. B. National CDI competency frameworks. C. Opinions of senior staff only. D. Popular online trends. 4. Which communication strategy is most effective when mentoring a new CCDS candidate? A. Delivering long lectures. B. Practicing active listening. Avoiding constructive feedback. D. Repeating guidelines without context. 5. Regulatory compliance in CCDS requires strict adherence to A. Internal office policies only. ECMS and coding guidelines. C. Informal communication norms. D. Physician preference. 6. Which evaluation method best measures CCDS candidates' ability to apply CDI knowledge? A. True-false recall questions. B. Case-based scenario assessments. C. Simple, multiple choice only. D. Open discussion without scoring. 7. A key aspect of mentoring in CCDS is A. Directing without input. B. Encouraging reflective practice. C. Avoiding performance feedback. D. Limiting access to resources. 8. Which factor best supports adult learners in CCDS exam preparation? A. Providing context for documentation practices. B. Enforcing silent study sessions. C. Avoiding interaction among learners. D. Focusing on memorization alone. 9. To evaluate program effectiveness for CCDS training, which approach is best? A. Tracking test pass rates only. B. Using pre- and post-assessments. C. Measuring attendance only. D. Relying on anecdotal success stories. 10. When designing case studies for CCDS learners, what principle is most critical? A. Alignment with real-world scenarios. B. Reliance on fictional, unrelated examples. C. Excessive detail without focus. D. Emphasis on abstract theories. 11. Which communication method reduces resistance from physicians when clarifying documentation? A. Using accusatory language. B. Presenting clinical evidence. C. Avoiding follow-up discussion. D. Focusing only on financial outcomes. 12. Adult learners preparing for CCDS certification benefit most from A. Practical examples tied to experience. B. Teacher-centered instruction only. C. Group memorization drills. D. Limiting discussion to textbooks. 13. A best practice for evaluating CCDS training outcomes is A. Collecting anonymous feedback surveys. B. Ignoring participant feedback. C. Assuming improved performance. D. Relying solely on exam scores. 14. When mentoring a CCDS trainee, which strategy fosters independence? A. Providing step-by-step answers. B. Encouraging critical thinking. C. Avoiding questions from trainees. D. Dictating one correct method only. 15. Regulatory compliance reviews in CDI should focus on A. Adherence to ICD-10 and CMS guidelines. B. Informal physician habits. C. Popularity of coding terms. D. Personal interpretation of rules. 16. Which adult learning principle applies when tailoring CCDS workshops to mixed experience groups? A. Recognizing prior knowledge. E. Assuming all learners are novices. C. Focusing solely on regulations. D. Ignoring participant diversity. 17. In evaluation methods, formative assessment in CCDS programs is best described as A. Continuous feedback during learning. B. Final certification testing only. C. Ignoring performance until exams. D. End of program surveys only. 18. A major role of communication in CCDS is A. Facilitate accurate physician queries. B. Eliminate all feedback loops. C. Focus exclusively on coding staff. D. Avoid interdisciplinary collaboration. 19. The most effective curriculum design for CCDS test prep should A. Integrate case-based and experiential learning. B. Use only textbook-driven content. C. Minimize participant interaction. D. Focus exclusively on exam memorization. 20. When mentoring colleagues on CDI best practices, an effective mentor A. Encourages open dialogue. B. Avoids discussing mistakes. C. Repeats instructions without context. D. Focuses only on passing exams. 21. Which evaluation tool best measures communication skills in CCDS practice? A. Standardized role-play scenarios. B. Multiple choice only. C. Peer opinion surveys alone. D. Self-reflection without feedback. 22. The principle of self-directed learning in CCDS training emphasizes A. Learner responsibility for progress. B. Instructor dominance in all tasks. C. Memorization without understanding. D. Avoiding technology resources. 23. In regulatory compliance, CDI programs must prioritize A. Accurate DRG assignment. B. Personal preference coding. C. Ignoring CMS guidelines. D. Relying on outdated practices. 24. Which mentoring approach supports novice CCDS professionals best? A. Pairing them with experienced specialists. B. Leaving them to work independently. C. Avoiding collaborative feedback. D. Limiting real-world exposure. 25. A critical evaluation measure in CDI program assessment is A. Quality of physician queries. B. Learner enjoyment only. C. Attendance records. D. Instructor approval rating. 26. Adult learning strategies in CCDS training should emphasize A. Problem solving and critical thinking. B. Memorization drills only. C. Long unstructured lectures. D. One-way communication. 27. Which communication element is key when resolving documentation disputes? A. Respectful, evidence-based discussion. Avoiding conversation entirely. C. Using technical jargon only. D. Ignoring the physician's perspective. 28. In curriculum development, sequencing content for CCDS prep should A. Progress logically from simple to complex. B. Begin with unrelated topics. C. Skip foundational knowledge. D. Randomized content order. 29. Which evaluation approach best measures retention in CCDS learners? A. Follow-up testing after sessions. B. One-time verbal questioning. C. Relying on attendance. D. Collecting instructor notes only. 30. A mentor can best support CCDS trainees by A. Modeling professional behavior. B. Withholding practical guidance. C. Avoiding one-on-one discussions. D. Focusing only on compliance audits. 31. Which adult learning principle ensures CCDS materials are meaningful? A. Linking to learners' clinical experience. B. Avoiding relevance. C. Presenting abstract theories only. D. Ignoring participant backgrounds. 32. An effective method of evaluating CCDS program impact on patient outcomes is A. Analyzing quality indicators. E. Measuring attendance. C. Reviewing staff satisfaction only. D. Conducting casual interviews. 33. The most effective communication for clarifying coding rules is A. Plain language explanations. B. Complex technical jargon. C. Ambiguous generalizations. D. Avoiding examples. 34. In regulatory compliance, CDI professionals must ensure A. Consistent use of official coding standards. B. Physician convenience overrides. C. Personal interpretation of terms. D. Ignoring ambiguous regulations. 35. Which curriculum design approach promotes deep CCDS understanding? A. Integrating problem-based learning. B. Relying solely on lectures. C. Using irrelevant case studies. D. Minimizing critical discussion.